Welcome to Module 5 of the Chapter 5 or 45 Rules training. This module will cover sections 20 through 26 of Chapter 45 Rules. It includes Section 20, Notification of the Incident Process, Section 21, the Complaint Process, Section 22, Transition Process, Section 23, Notice of Costs to the Participant, Section 24, Participant Funds and Property, Section 25, Additional Standards for Providers that require National Accreditation, and Section 26, the Mortality Review Committee. Section 20, Notification of Incident Process. Providers are to report critical incidents to the division in the categories in this PowerPoint. The division's #1 priority is the health and safety of the participants. The division uses critical incidents to not only ensure health and safety and compliance with the rule, but it is a snapshot into the participant's life that can spur resources for providers and support staff serving clients. If a life-threatening incident happens, please call emergency services or law enforcement first before notifying the division. So let's get to the reporting categories. A provider shall report the following categories of serious critical incidents involving waiver participants to the division, the Department of Family Services, Protection and Advocacy Systems, Inc., the case manager, any legally authorized representatives, and to law enforcement immediately after assuring the health and safety of the participant and other individuals. The categories of serious critical incidents are suspected abuse, suspected self-abuse, suspected neglect, suspected self-neglect, suspected abandonment, suspected exploitation, suspected intimidation, sexual abuse, and a death. All providers shall report the following non-critical incidents to the Division, Protection and Advocacy Systems, Inc., the case manager, and any legally authorized representative within 1 business day. The categories are police involvement, any use of restrictive interventions, any use of seclusion, injuries caused by restraints, serious injury to the participant, elopement, medication errors, medical or behavioral admissions, and emergency room visits that are not scheduled medical visits. Please note the new requirements for incident reporting, which are marked in the slide with asterisks. Please refer to Section 18, Restrictive Interventions for reporting and how to report the use of any restrictive intervention or seclusion. Medication errors include the wrong medication, the wrong dosage, a missed medication, a wrong participant, a wrong route, a wrong time, which is any deviation from accepted standard time frame for the medication assistance. Medication error reports that do not result in emergency medical attention must be filed no later than 3 business days after the event is discovered in order to give the provider time to complete all follow-up prior to reporting. A wrong time example would include if the medication is tied to an event, such as 30 minutes prior to a meal, or a sleeping medication that is tied to bedtime. In addition to the other provisions of this section, if at any time a significant risk to a waiver participant's health and safety is found, the provider shall report the incident to the division. Providers shall have incident reporting policies and procedures that include the requirements of this section and maintain internal incident reports for all critical and non-critical incidents identified in this section. Providers shall review internal incident data, including the people involved in the incident, the preceding events, what follow-up was conducted, causes of recurrent critical incidents, other trends and actions taken to prevent similar events from reoccurring, evaluation of actions taken, education and training of personnel, and internal and external reporting requirements. Providers shall provide access of internal incident data to case managers within 5 business days. Providers shall comply with division or other agency requests for additional information relating to the incident. To report an incident to the division, please follow the URL listed in this PowerPoint. Please provide as much detail as possible when filing the incident. When reporting critical incidents using the online form, you must also notify the following entities: Department of Family Services for critical incidents that are serious, Protection and Advocacy Systems, Inc., the case manager, any legally authorized representative, and law enforcement, if applicable, for example, in cases of abuse, neglect, abandonment, exploitation, or intimidation. When completing the critical incident form, please be specific, including names and the phone and email information in the notification section of the form. This assists the division to ensure proper follow-up with those agencies. On the online form, please include the name and phone number of the person you spoke to while reporting. This is extremely important for the division to know who to follow up with at DFS, with law enforcement, or whoever else. Section 21, the complaint process. For accredited providers, all accredited providers, those with CARF or CQL, shall adhere to the current accreditation requirement for complaints and grievances, as well as requirements in this chapter. Should there be a complaint or grievance that does not involve a health and safety issue, the person will be asked by the division to contact the provider first and work through their identified policy prior to making a formal complaint with the division. A provider who believes a participant's health and safety is in jeopardy shall immediately contact the division, Protection and Advocacy, and other applicable governmental agencies such as law enforcement or the Department of Family Services. Upon receipt of any complaint from any person, the division shall notify the complainant within 10 calendar days in writing that a complaint was received. They will notify the provider in writing when a complaint is received involving the provider, unless an on-site visit is warranted, at which time the provider will be notified at the time of the visit. The division will also notify the complainant when a complaint has been investigated and closed, and submit a written report to the providers involved, summarizing the results and including any findings, recommendations, and timeframes to address recommendations through the corrective action process. A provider's failure to complete a corrective action plan may result in sanctions. Section 22, the transition process. A provider who is terminating services with a participant shall notify the participant in writing at least 30 days prior to ending services. Failure by the provider to deliver services during this 30-day period shall be considered abandonment of services and may result in the decertification of the provider. When a participant wishes to change a provider, case managers shall notify the provider of a participant's decision to discontinue services within 3 business days. If a residential provider requires the participant to move, a 30-day notice must be provided so the participant can exercise choice in the matter. A participant may choose to change any provider at any time and for any reason. When a transition occurs, the case manager shall notify the division of the request for change within 5 business days. They will complete a transition checklist as needed, schedule a team meeting, and provide notification to members 2 weeks prior to the meeting. And they will also modify the plan of care. Section 23, Notice of Cost to the Participant. Providers shall develop and implement a system to notify participants and legally authorized representatives of associated costs to the participant for a service or item and the terms of payment. A written notice must be given to participants before the initiation of services and before any change. Time must be allowed for the participant or legally authorized representative to review the notice before choice is made or changes are implemented. A provider's cost notice must specify that participants will not be charged for services or items that are covered through other funding sources. A cost notice must identify who is responsible for compensation when the participants' personal items are damaged or missing, and how participants will be compensated when staff, guests, or other participants in service who do not reside in the location utilize the environment and eat food paid for by participants. Participants may not be charged for changes to provider staffing, facility, or services. Section 24, Participant Funds and Personal Property. Taking responsibility for the funds or personal property of a participant includes serving as a representative payee, involvement in managing the funds of a participant, receiving benefits or funds on behalf of the participant, or temporarily safeguarding funds or personal property for the participant. Policies must be developed, implemented, and shared with the participant or legally authorized representative. Use of participant funds and personal property. Participant funds shall not be combined with provider business accounts or monies. Standards in this section apply to any provider who takes responsibility for the funds or personal property of a participant. The provider's policies must include how the participant or any legally authorized representative will give informed consent for the expenditure of funds, how the participant or legal representative may access the records of the funds, how funds are segregated for accounting and reporting purposes to the participant, legally authorized representative, and regulatory agencies such as Social Security Administration or the Division of Healthcare Financing. Safeguards used to ensure that funds are used for the designated and appropriate purposes. If interest is accrued, how interest is credited to the accounts of the participant, how service fees are charged for managing funds, and how the person's funds or personal property will be replaced or recouped in the event of theft or an unexplainable disappearance at the provider facility or during a provider's provision of services. Providers may not use or allow participant funds or personal property to be used as a reward or punishment unless specified in the plan of care as a restriction of rights that complies with the requirements in this chapter and is approved by the participant and legally authorized representative. They may not use or allow participant funds as payment for damages unless otherwise specified in the lease or other written agreement with evidence provided showing the charge is appropriate for the participant to make restitution. The rationale must be documented, and the participant or legal representative gives written informed consent to make restitution for damages. They may also not be allowed to be used as payment for damages when the damage is the result of a lack of appropriate supervision, and they also may not be used to purchase inventory or services for the provider or on loan to the provider or the provider's employees. Section 25, Additional Standards for Providers that Require National Accreditation. The division recognizes accreditation from the following agencies: the Commission on the Accreditation of Rehab Facilities, otherwise known as CARF, and the Council on Quality Leadership, or CQL. Other accreditation agencies must be approved by the division prior to becoming accredited. So who needs to get national accreditation? Well, providers who deliver one or more of the following services to 3 or more participants: residential services, supported living, community integration, adult day services, pre-vocational, and any supported employment service. And the providers must receive a total annual waiver income that equals or exceeds $125,000. And this is for all participants and all services. Providers shall obtain accreditation in the area applicable to each service within 18 months of qualifying under this provision. The provider will maintain the accreditation as long as they provide the qualifying service or services to 3 or more participants. The division will decertify any provider who fails to maintain accreditation. If the provider fails to maintain their accreditation, the division will require the provider to submit a transition plan for each participant who is leaving the provider's services, and the participant will be relocated to a provider of their choice within 90 days that the division receives confirmation that the provider is no longer accredited. The provider's decertification date will begin 90 days from the date of the written notice from the accrediting entity stating that the provider did not receive accreditation. An accredited provider shall submit all National Accreditation report documents to the division within 30 days of receiving the report documents from the accrediting agency. Section 26, Mortality Review Committee. The divisions shall maintain a mortality review committee to review deaths of participants receiving waiver services. Please note the Mortality Review Committee is now known as the 1915C Waiver Committee, which reviews deaths and other participant health and safety issues on all waivers administered by the Wyoming Department of Health. The 1915C Waiver Committee meets monthly to review participant deaths and other serious critical incident information. The committee may make provider-specific recommendations or systemic recommendations. Providers are required to provide information requested by the Mortality Review Committee or the 1915C Committee. Information requested may include, but is not limited to, copies of service documentation, copies of incident reports, copies of any health-related records, assessments, and results of physician office visits and hospital visits. Please respond to requests for information in a timely manner to ensure proper review of cases. This concludes Module 5. Please join us again for Module 6.